friend Alan Valenzuela joining us today, President and CEO of Alliance Physical Therapy, and we're talking about dry needling. Now, tell us about dry needling, Alan.
Okay, so the needle is a filament needle. It's a lot like it actually is like what acupuncturists use. So if you've ever had acupuncture, these are the same tiny, skinny needles. Nothing like getting a shot.
So we're going to be homing in on Chris's back. So if you have back issues, you may want to look into dry needling. Now, what are we looking at when it comes to the length of the needles? The needle varies in sizes, right?
Yeah, so if we're working on somebody with headaches, we're going to use a smaller depth needle, okay? The thickness of the needle can change as well, especially if you're going really deep. You want a thicker needle so it doesn't bend as you're putting it into the tissue. But, and here's an example. So here is maybe a moderate sized needle here that you can see. This it's a very long needle.
That is a long needle. Okay.
It's a little scary, but the thing is so skinny.
Yeah.
So you would see this, you would use this maybe on a low back, somebody's having back pain, and that have a lot of tissue you've got to get through. Because when we're dealing with back, we want to get to the multifidus muscles. The multifidus muscles are laying right up against the bone, the vertebrae. Yeah. And the reason why we want to get to those is because oftentimes they become spasmodic. There's a lot of tone in them, and they squeeze the vertebrae together. And when they do that, they shut the hole where the nerves are exiting the spinal canal. If that happens, you get impingement on that nerve, you get pain at the area, or you get pain down into an extremity or into a buttock. And if that happens, you can also use the longer needles to get through the buttock tissue as well and get to the pelvic girdle.
So just before the segment, you cleaned off Chris. He's all prepped and ready to go. What are these leading
I've hooked Chris, these two up to an electrical stimulation. So oftentimes it's really nice to add stimulation through the needles to the muscle that you're trying to relax.
Sure.
By adding that stimulation, it contracts it, fatigues it, cause it to relax, and then the bones separate.
How long is the therapy from start to finish?
Honestly, it's going to vary. So if I go to clinic, I may only just stick a needle in somebody real quick and then take it out, and I'm done. Yeah. If I'm not getting the results, I may stick the needle in by themselves and leave them for 3 minutes, maybe 5 minutes. Or I may stick the needle in, add the e-stim for maybe 10 seconds, 20 seconds, maybe a minute. It just depends on how the patient responds.
Yeah. Chris, okay, I know you're not mic'd, but are you awake? Okay, and did you even feel the needle?
Not at all.
Not at all, yeah.
So I'm just going to put one more into his low back just so that people can see what it's like. So just pop it in there. You can see it sticking out of the tissue, and then I'm just going to work it down into the tissue nicely, and I'm looking, and this needle isn't long enough to do his low back, but I'm looking to get through muscle tissue and get to the bone. And I want to leave a little space there between the handle of the needle and the needle itself.
Okay, so with Chris dealing with some lower back issues, how many therapy sessions will he have to maybe alleviate the pain?
Everybody's different.
Okay.
But dry needling sometimes works in one session.
Alrighty.
Yeah.
Chris, thank you very much. You're a good sport.
Thanks, Chris.
Alan, Alan, thank you very much for joining us.
Appreciate being on the show.
Alliance Physical Therapy, they've got 11 locations. Great place.